Hello, welcome to Human Health. Today we will discuss about measles, its prevention and treatment. Measles is scary but is preventable disease. Measles is a highly contagious viral illness that can cause a rash, fever, cough, runny nose, and sore throat. It is caused by a virus called rubeola. Measles is a serious disease that can lead to pneumonia, encephalitis, inflammation of the brain, and death. Measles primarily affects children. The measles virus belongs to the family Paramyxoviridae. Measles is transmitted through respiratory droplets when an infected person coughs or sneezes, making it extremely contagious. The typical symptoms of measles include high fever, cough, runny nose, red and watery eyes, conjunctivitis, and a rash that starts on the face and gradually spreads to other parts of the body. The rash usually appears a few days after the initial symptoms and consists of small red spots that may merge together. In addition to these common symptoms, measles can also cause complications, especially in young children and individuals with weakened immune systems. Complications can include ear infections, pneumonia, encephalitis, inflammation of the brain, and in rare cases, even death. Signs and symptoms of measles. The symptoms of measles usually appear 7 to 14 days after exposure to the virus. The first symptoms are usually fever, cough, runny nose, and sore throat. These symptoms may be followed by a rash that starts on the face and spreads to the rest of the body. The rash usually lasts 5 to 7 days. Complications of measles. Measles can cause a number of serious complications, including pneumonia. This is an infection of the lungs that can be life-threatening. Encephalitis. This is an inflammation of the brain that can cause brain damage or death. Meningitis. This is an inflammation of the membranes that surround the brain and spinal cord. Ear infections. These can cause hearing loss. Diarrhea. This can lead to dehydration. Death. Measles is a leading cause of death among children in developing countries. Prevention of measles. The best way to prevent measles is to get vaccinated. The measles vaccine is very effective and can prevent 97% of cases of measles. The vaccine is given as part of the MMR vaccine, which also protects against mumps and rubella. Treatment of measles. There is no specific treatment for measles. Treatment is supportive and includes rest, fluids, and pain relievers. In some cases, antibiotics may be given to prevent or treat secondary infections. Home tips and tricks. There are a few things you can do to help your child feel better if they have measles. Keep your child home from school or daycare until they are no longer contagious. Give your child plenty of fluids to drink. Make sure your child gets plenty of rest. Use a cool, damp washcloth to wipe your child's forehead and body. Administer over-the-counter pain relievers and fever reducers as directed by your doctor. If your child has a cough, you can give them a humidifier or take them into a steamy bathroom. If your child has a rash, you can bathe them with a cool, wet washcloth. Measles is a serious disease, but it is preventable. If you are not sure if you or your child has been vaccinated against measles, talk to your doctor. Here are some additional facts about measles. Measles is a highly contagious disease that can spread through the air when an infected person coughs or sneezes. Measles is most contagious 4 days before to 4 days after the rash appears. There is no cure for measles, but the symptoms can be treated. The best way to prevent measles is to get vaccinated. The measles vaccine is safe and effective. The measles vaccine is given as part of the MMR vaccine, which also protects against mumps and rubella. If you think you or your child may have measles, it is important to see a doctor right away. Here are some additional tips to help control measles from getting severe. Avoid contact with people who are sick. Cover your mouth and nose when you cough or sneeze. Wash your hands often with soap and water. Clean and disinfect surfaces that may be contaminated with the measles virus. If you think you or your child may have measles, it is important to see a doctor right away. Thanks for watching this video. Please subscribe us to get more information like this and share this information with others.